Cutting off alcohol consumption completely has profound effects on various aspects of an individual's health, well being, and lifestyle. This decision can lead to significant physiological, psychological, social, and economic changes. Hi, guys. Welcome back to our channel. Have you ever wondered what will happen if a person completely cuts off from consuming alcohol? In today's video, we will dig into this fact. Let's get started. Throughout the world, alcohol has become a vital part of many cultures and communities, acting as a coping method, a celebratory tool, and a social lubricant. But alcohol is also linked to a number of harmful health impacts, both short-term and long-term. Making the decision to give up alcohol entirely can have a profoundly positive impact on one's life. However, there are drawbacks as well, especially for heavy or chronic drinkers. Physiological effects. Number 1. Live healthier. The organ mainly impacted by alcohol is the liver. Alcohol is processed and detoxified by it, but long-term use can harm the liver and cause conditions like fatty liver disease, alcoholic hepatitis, cirrhosis, and fibrosis. When alcohol is eliminated from the diet entirely, the liver starts to repair itself. This can lead to a notable improvement or even full recovery for patients with mild to moderate liver impairment. In more severe situations, abstaining from alcohol can slow down the decline and, in some cases, even restore some of the liver's function. Number 2. Cardiovascular system. Increased HDL, good cholesterol, is one cardiovascular benefit that has been connected to moderate alcohol use. Nonetheless, a substantial risk factor for hypertension, cardiomyopathy, arrhythmias, and stroke is an excessive alcohol use. Giving up alcohol can enhance cardiovascular health overall, lower blood pressure, and lower the risk of heart disease. Those who are at risk or have a history of cardiac issues would benefit most from this. Number 3. Brain and nervous system. Alcohol is a central nervous system depressant, and chronic use can lead to cognitive impairments, memory loss, and an increased risk of developing neurological conditions like dementia. By cutting out alcohol, the brain can begin to recover from the damage caused by chronic drinking. Neurogenesis, or the formation of new neurons, can be stimulated, improving cognitive functions, memory, and overall mental clarity. However, in cases of severe alcoholism, some neurological damage may be permanent. Number 4. Weight and metabolism. Alcohol is calorie-dense, providing 7 calories per gram. It can contribute significantly to weight gain. It also disrupts metabolic processes, leading to fat accumulation, especially in the abdominal area. Eliminating alcohol can lead to weight loss, improved metabolism, and better control of blood sugar levels. This is particularly beneficial for individuals with or at risk of type 2 diabetes. Number 5. Immune system. Alcohol impairs the immune system, making the body more susceptible to infections and slowing down the recovery from illnesses. Once alcohol is removed, the immune system becomes more robust, reducing the frequency of infections by improving the body's ability to fight off diseases. Psychological and emotional effects. Number 1. Improved mental health. Even though alcohol is commonly employed as a coping method for stress, anxiety, and depression, it can eventually make these sensations worse. Giving up alcohol can result in better mental health and fewer signs of anxiety and despair. This is partially due to there are no alcohol-induced mood swings and neurotransmitter stability. People could ultimately find more beneficial methods of coping, which involve vigorous exercise, meditation, or counseling. Number 2. Better sleep. Alcohol disrupts the sleep cycle, particularly the REM, rapid eye movement stage, leading to poor quality sleep and fatigue. Once alcohol is eliminated, individuals often experience more restful sleep with fewer disruptions. This improvement in sleep quality can enhance overall well-being, cognitive function, and energy levels during the day. Number 3. Enhanced emotional stability. Drinking can cause impulsive carryout and a decreased level of inhibitions, which can strain relationships and result in bad decisions. People may have greater emotional stability and greater control over their emotions when they abstain from alcohol. More effective connections between individuals and businesses may result through this. Social and lifestyle changes. Number 1. Social dynamics. For many people, alcohol has played an essential role in social interactions. Eliminating alcohol from one's life can initially make one feel uncomfortable or alone in situations in society when drinking is accepted, but people eventually discover new ways to meet people, typically centered around non-alcoholic beverages pursuits. This may result in the pursuit of new interests and pastimes, as well as the establishment of more substantial connections with others. Number 2, financial benefits. Drinking alcohol can be an expensive habit, especially for social or regular drinkers. Giving up alcohol might result in large financial savings that can be used for investments, travel, or other more worthwhile or beneficial endeavors. Number 3, time management and productivity. Alcohol consumption, especially in excess, can lead to wasted time and reduced productivity. Time spent drinking, recovering from hangovers, or dealing with alcohol-related problems can be substantial. Without alcohol, individuals often find they have more time and energy to devote to their goals, leading to increased productivity and personal growth. Drinking too much alcohol, in particular, can result in lost time and decreased productivity. It can take a lot of time to drink, recover from hangovers, or deal with alcohol-related issues. When alcohol is absent, people frequently discover they have more time and energy to focus on their objectives, which promotes greater productivity and personal development. Long-term health benefits. Number 1, reduced risk of chronic diseases. Long-term alcohol consumption is linked to various chronic diseases, including certain cancers such as liver, breast, and colon cancer, cardiovascular diseases, and neurodegenerative disorders. By eliminating alcohol, the risk of developing these conditions decreases significantly. This can lead to a longer, healthier life. Chronic alcohol use has been related to a number of chronic illnesses such as heart disease, neurological disorders, and several malignancies, including liver, breast, and colon cancer. By eliminating alcohol, it considerably lowers the chance of getting these illnesses. A longer and healthier life may result from this. Number 2, improved longevity. Research has indicated that excessive alcohol use may shorten one's lifespan. Eliminating alcohol consumption may help people live longer. Studies have shown that heavy alcohol consumption can reduce life expectancy. By cutting out alcohol, individuals can potentially increase their lifespan. The reduction in the risk of accidents, injuries, and chronic diseases contributes to this increased longevity. This longer lifespan is a result of lower chance of mishaps, injuries, and chronic illnesses. Number 3, reverse of alcohol-related conditions. For those who have already developed alcohol-related conditions, stopping alcohol can lead to significant health improvements. Conditions such as alcoholic liver disease, alcohol-induced neuropathy, and alcohol-related heart disease can stabilize or improve with complete abstinence. Challenges and considerations. Number 1, withdrawal symptoms. Abruptly stopping alcohol consumption in heavy or dependent drinkers can result in withdrawal symptoms that can vary in severities from moderate tremors and anxiety to seizures and delirium tremens. To properly treat these symptoms of alcohol withdrawal, it is imperative that those with a history of heavy drinking get medical guidance before quitting. Number 2, social pressure and stigma. Drinking alcohol is socially accepted in many countries, therefore giving it up can put one under pressure or make one feel alone. People could encounter injuries, criticism, or even mockery from their peers. It takes resiliency to navigate these social dynamics, as well as occasionally a change in social groups or the setting of clear limits. Number 3, psychological dependency. Some people may experience psychological alcohol dependence, even in the absence of physical dependency. They might have turned to alcohol as a coping mechanism for stress, nervousness in social situations, or mental distress. In order to overcome this psychological reliance, one needs patience, support, and frequent expert assistance, like counseling or therapy. Number 4, finding new coping mechanisms. Without alcohol, individuals need to find new ways to cope with stress, anxiety, or other emotions. This can involve developing new habits, such as exercise, mindfulness, or engaging in hobbies. It may also involve addressing underlying issues that led to alcohol use in the first place, such as trauma or mental health disorders. Cutting off alcohol completely can lead to significant improvements in various aspects of life, encompassing physical health, mental well-being, and social interactions. Physically, one of the most immediate benefits is the recovery of the liver, which is heavily impacted by alcohol consumption. Chronic drinking can lead to liver conditions like fatty liver disease, hepatitis, and cirrhosis. By eliminating alcohol, the liver can begin to heal, reducing the risk of these conditions and improving overall liver function. Cardiovascular health also benefits greatly. Alcohol is known to increase blood pressure and contribute to heart disease. Without alcohol, blood pressure tends to stabilize, the heart becomes healthier, and the risk of related conditions like strokes and heart attacks diminishes. Additionally, alcohol is calorie-dense, and its elimination often results in weight loss, particularly around the abdomen, leading to a more balanced metabolism and healthier body weight. The immune system, which alcohol weakens, also becomes more robust, making the body better equipped to fend off infections and recover from illnesses. Mentally, the cessation of alcohol can lend to enhanced cognitive function and mental clarity. Alcohol is a depressant that can impair brain function over time, leading to issues with memory, decision-making, and overall mental health. In the long term, cutting off alcohol reduces the risk of numerous chronic diseases, including certain cancers, cardiovascular diseases, and neurodegenerative disorders. This decision can also contribute to increased longevity as the body's overall health improves. For those who have already developed alcohol-related conditions, quitting can halt the progression of these diseases and in some cases lead to significant improvement. Ultimately, eliminating alcohol from one's life can lead to a healthier, more balanced, fulfilling existence with improvements in physical health, mental clarity, emotional stability, and social relationships. The journey to sobriety, though challenging at times, offers profound rewards that enhance the overall quality of life. I hope this video was informative for you. Do like, share, and subscribe to our channel. Hit the bell icon for the latest updates. See you soon!